But we go to Dr. Ahluwalia with Lisa, and Rosie O'Donnell in the news about a heart attack, and it's a lesson for a lot of women.
Yeah, it really is a wake-up call because a lot of women do what she did, which is the wrong thing, right, Dr. Ahluwalia?
Exactly. Lisa, I think the most important thing for women to note is that women have different symptoms from men. We all know that you have chest pain, you have arm pain, you're having a heart attack. But about half the women will not have chest pain. They will only have shortness of breath, a feeling of fatigue, some anxiety, some indigestion.
So that could be anything.
Exactly.
You think, you know.
Yes, exactly. But I think that most women don't think that it could be something else. So it's important to recognize that if you have the risk factors for heart disease and you start to have these symptoms that you've never had before, you need to worry a little bit.
Quickly, your risk factors for heart disease would be?
So high blood pressure, high cholesterol, diabetes, family history, and most importantly for women is menopause. So as you get postmenopausal, your risks start to increase.
Okay, so you do need to call 911 because most of the women don't.
Exactly. First thing to do is call 911. Second thing to do is to take an aspirin, a full aspirin, not a baby aspirin, and chew it or crush it because it gets into your bloodstream faster.
Chew or crush?
Yes.
Crush.
Exactly.
Okay, I did not know that.
Yeah, exactly. So I think it's important to know that the aspirin can save your life, and that's what Rosie did. She looked it up on the internet, she took her aspirin, and she called 911, but didn't really go in, and went to her cardiologist the next day. But these are things that can really cause a problem. So if you think you're having a heart attack, call 911.
Okay, yeah, don't you want to be for sure.
Yes.
So West Nile virus, that's been in the news a lot, and it's worse this year than in previous years.
Yeah, you know, because of the weather, we think, because we had a mild winter and an early spring, it seems to have not killed all the mosquitoes during the winter. So they have come back in full force this year. And we see an upsurge in the West Nile virus, which is basically a virus that's transmitted by mosquitoes who bite a bird that has the virus and then bite a human being.
Okay, so what can we do to prevent it? Does a mosquito repellent work, or that doesn't work?
Absolutely, a mosquito repellent works. You know, most of the mosquitoes come out during dusk and dawn. So stay indoors during that time. If you need to go out, wear long sleeve shirts, you know, wear long pants. The other thing is the people who are most likely to have a problem from the West Nile virus are older relatives and people who are immunocompromised. So those are the people who should really watch out. And also, you know, we don't want to scare people.
Yeah, because this is not like the flu. The flu takes way more lives than, I mean, you don't want to lose one. But
right. So 80% of people have no symptoms.
Okay.
20% of people have, you know, flu-like symptoms, fever, malaise, things like that. Only 1 in 150 people are going to die from this problem. But that's a lot anyway. Nobody should die from West Nile virus. So I think it's important to recognize, use your Adit or whatever other mosquito repellent, and be careful during dusk and dawn.
Okay, Dr. Ahluwalia, thank you so much. As always good to learn.
Yeah.
Steve, take that aspirin when you need it.
Yep.
Dr. Ahluwalia.